Hello, guys. Good afternoon. Dr. Barry, board certified internist, founder at drpsblog.com, author and speaker. Bring you another edition of today's Lunch and Learn. And today we're going to be talking about blood pressure. Like always, housekeeping things. We're going to go ahead and wait for a few folks to come and jump on, and then we're going to kind of start this proceedings off right. Again, thanks for showing up. As we remember, on our last Lunch and Learn, which actually had to happen at almost 9-10 o'clock at night, time management was an issue. We got that kind of taken care of. I had one patient kind of came in late, but that's all right. We're here to take care of the sick, especially before the weekend comes about. So we're gonna give it a few, not too long. Let's say 30 seconds or so. Then we'll get right started. And today's topic again is blood pressure. We're going to be talking about 5 common causes for blood pressure and what we can do about it. Okay, so we are getting started here today again. Just to introduce myself, if you're coming on a little bit late, my name is Dr. Barry. I am your board certified internist. I'm founder at drpsblog.com. I'm an author, I'm a speaker, and I do this Lunch and Learn twice a week, Tuesdays and Thursday afternoons, trying to give out what little wisdom I think I have on various medical and public health topics that I think you guys, the community, my Facebook community, and whoever tends to watch this needs to know. So today's topic is on blood pressure, and the reason why it's on blood pressure, as a primary care physician, is something that I deal with every single day. There's not a day in my clinic that goes by, not a day, and even in the hospital setting that goes by where I'm not dealing with someone who's dealing with high blood pressure. And I get kind of the same questions over and over and over again. And I think the biggest one is pretty much the causes, and there is a lot. We're probably going to go through probably like the top 5 today, and just kind of, and that's going to kind of encompass a lot of the reasons why people have high blood pressure, especially in this country. First and foremost, so let's start out. So number one, and again, this isn't in any chronological order as far as most common to least common. This is just very, I'd say probably 5 of the most common reasons why we're dealing with blood pressure the way we are today. So I think the first one is, I think it's fairly obvious, is genetics. I have a lot of my patients, even my younger patients. By younger, I'm talking in 20s and 30s, who are being diagnosed with high blood pressure. And I think and they're always shocked because a lot of times they're, great eaters, perfect eaters, exercise all the time, and they still have high blood pressure. In fact, I have a patient in my practice who is 41. And he's an avid, bodybuilder, works out all the time, extremely fit. And he had to have triple bypass surgery, which is an extremely intensive cardiothoracic surgery because of, uncontrolled blood pressure that he didn't know about. And that's probably, I think, one of the problems with high blood pressure is that there really isn't any symptoms until we run into problems. You don't really tend to have any problems with high blood pressure. You don't feel when your pressure is high, even though a lot of people tell you you do. When you start feeling that you have high blood pressure, that's actually a problem. Our body does a very good job at controlling as much as it can from a blood pressure standpoint until it can't. So I think number one, first and foremost, genetics plays a huge factor in blood pressure in general. You know, if your mom has blood pressure issues, your dad has blood pressure issues, grandma, grandpa, uncle, aunts, you know, if they have blood pressure issues, the likelihood of you getting blood pressure issues as well is going to be already pretty high. So that's, you know, first and foremost, you know, right off the bat, in that regards. I think number two, and then, you know, this is something that I kind of struggle with. You know, fortunately, I don't struggle with high blood pressure, but, you know, being overweight. So we know, and I'm gonna throw a quick caveat in there because I know there's gonna be a lot of, you know, people say, oh, I'm overweight, I don't have high blood pressure. Good, you know, congratulations, right? Being overweight is a risk factor for having elevated blood pressure concerns and problems there. So, and that's something why, you know, usually, and for those who are hypertensive or who have high blood pressure or know family members who have high blood pressure, one of the first things, you know, the doctors, you know, that we're quote unquote telling you is to lose some weight, because we know that you know, the excess weight does cause you know, some cardiovascular problems in the long run that we know can be helped with your blood pressure. Because I have a lot of patients in who, you know, they lose, you know, 10, 20, 15 pounds, 15, 20 pounds, and all of a sudden they don't need to be on the blood pressure medications anymore. And, you know, it's not just the weight factor alone. It's a lot of things that kind of go with being overweight. But we know, you know, that's a very, very common risk factor. If you're overweight, the likelihood of you having high blood pressure is higher. Now, go ahead so I can do a quick spin on that. Just because you're skinny, that does not mean you're not going to have high blood pressure problems. I got a lot, and in fact, I probably in my practice, I have a lot more skinny patients, right? Oh, hey, Taylor, how you doing? Taylor, we're talking about blood pressure and 5 very common causes of it. I got a lot more skinnier patients in my practice with blood pressure issues than I do with, you know, my overweight patients. My overweight patients tend to have, you know, more like diabetes type cholesterol problems, but blood pressure seems to really affect my my skinnier patients more than that. So yes, being overweight is a risk factor, but that does not mean if you're smaller, if you're skinny or anything, you can't have high blood pressure problems. But we do know that it is a very common risk factor associated with it. And the third one's gonna be big, especially for my dietitians and my wellness physicians out there. Diet is huge responsibility in terms of dealing with blood pressure. And when I talk about diet, the big first thing you will always hear is the salt intake. From that standpoint, there. Hold on for a second. Okay, I guess they didn't need me. Salt intake is very. Okay. Salt intake is very huge for patients dealing with high blood pressure, and especially for my African American patients too. I have a lot of African American patients. The reason being is that there's actually studies that's shown that for African American patients, and actually a lot of patients of the minority descent, that we tend to be more what we call salt sensitive than other races. And what that means is if I have, let's say I eat a French fry. French fry has, let's say, a gram of salt. It doesn't. But let's say I eat a French fry, a gram of salt. And, maybe, a friend of mine, who's white or, Spanish or anything, and they eat that same French fry. My body, is affected much more by that salt content than they will be. So when we talk about salt sensitivity, especially in our African American community, that's what we're kind of really focused on, is that for some reason, two people can have the same amount of salt intake, but, if you're African American, we know that salt intake is much more greatly affects us on a blood pressure standpoint. So again, dietary is big factor in our blood pressure. And then alcohol is, and this isn't a lot of alcohol. This is, a person who probably consumes 1 to 2 drinks, on a daily basis. We know that alcohol consumption is another risk factor for patients with high blood pressure, and even blood pressure that's even difficult to control. From that standpoint there too. So when we talk about diet, yes, we know diet is huge. We know that the salt intake is a big thing for us. A lot of my patients in the hospital, the second they go in there, we put them on a low salt diet. That's just the standard. If you have high blood pressure or any heart related symptoms, you're automatically going on a low salt diet. Reason why is because if you take in excess salt, your body has to hold on to more fluid to deal with that excess salt. So because of that, we try to restrict salt as much as possible. I have some patients that they almost can't touch any salt because a little, a bag of chips or, a piece of ham is enough to kind of, throw them overboard from a salt intake standpoint. I think, so, and then we talked about alcohol. And again, this isn't, this is wine, this is beer, hard liquor. Alcohol is a big and huge component in terms of, dealing with high blood pressure and causing risk factors from a high blood pressure standpoint. Smoking, that's my fourth one. First of all, let me just do my, PSA here. If you're smoking cigarettes, please stop. Please just stop. Like there's really no, I don't have to, you could Google a True commercial and tell you all the reasons why you shouldn't drive. But you definitely should not be smoking cigarettes. I mean, with all of the bad things that are associated with cigarette, like this, first of all, there's not one single cancer that smoking does not have a risk factor in it and causes you to have an increased chance to get it. Not one, which is, crazy. From a medical standpoint, if I get a test question where, patient has so-and-so blood pressure, patient has so-and-so cancer, what is the one thing you can tell them to stop doing that would improve their chances? If smoking is an answer choice, smoking will always be the answer. So on my, my stoop, please, if you're smoking cigarettes, don't smoke anything at all, but if you're smoking cigarettes, and I know my marijuana people are probably gonna like, oh, what about marijuana? We talked about marijuana. That's a whole nother discussion. I forget. I think it's episode 7 or 8. Check my Facebook video log to see which episode it was. But we talked about marijuana in that regard. But if cigarettes, don't smoke it. And again, this is another risk factor that we know dealing with high blood pressure. We know patients who smoke cigarettes are at an increased chance to get high blood pressure. Not only are they at an increased chance to get high blood pressure, they're at an increased chance of having uncontrolled high blood pressure from a lot of pathophysiological standpoint that, is not really important at this time here. What's going on? My brother's on the Facebook live video. What's going on, Steve? We're talking about blood pressure today, and I went through 4 reasons. So far, I went through 4 reasons why four common causes, not all of them, but 4 common causes for blood pressure. One we talked about was genetics, mom, dad, and uncle blood pressure issues. We talked about being overweight. We talked about the salt diet, diet in general, and we talked about diet in general from salt, alcohol intake. Right now we're talking about smoking, cigarettes, tobacco use will put you at increased risk for being hypertensive or high blood pressure as well. And then last but not least, stress. And stress, this is extremely important because I got a lot of patients who are on medications, especially blood pressure medications, strictly because of a lot of what's going on pretty much around them, around their life, job, work, like financial, everything is just, and a lot of that stress. And what tends to happen with stress builds up a lot of hormones and things that our bodies that really aren't used to. So if you're in a constant state of stress, you're in a constant, and when you're in a constant state of stress, you're not only putting stress mentally, but you're putting stress physically. So your blood pressure is rising, your heart rate's rising. All of these risk factors are starting to come into play here. So stress is a big thing. So when I have my patients with blood pressure problems in general, I always want to make sure yes, I can give you medication because there's plenty of medications to treat blood pressure. But a lot of times if we don't really try to treat the reason why they're having blood pressure, then we're only doing half the job. And as from a physician standpoint, I think that's probably the most important thing. Not just treating the number, which for and we'll talk for a blood pressure standpoint. When we talk about the number, for blood pressure, you get 2 numbers. You get a top number and a bottom number. We won't go into specifics on what they're called, but your top number should be less than 140, and your bottom number should be less than 90. Any number over that, hey Maria, any number over 140 for the top number, over 90 for the bottom number, you have high blood pressure. And it's it's really important, especially from a physician standpoint, to know, what your numbers are. A lot of us, go to the grocery stores, we go to Walmart, we go to CVS, we go to all these places here that, check your blood pressure for free. Go ahead and do that, because again, your blood pressure isn't like when you have, when you stub your toe, isn't like when you have back pain. When you have high blood pressure, you can walk around and have no problems whatsoever. You can do that for years. I have patients who are in their 50s and 60s walking in, they haven't seen a doctor for a while, and they come in and their blood pressure is like 160 over 95. So it's very common for you to have high blood pressure and have no symptoms whatsoever in that regard, and that's why it's such a difficult disease to kind of treat, because from a symptom standpoint, you don't know the difference on when your blood pressure is good or when your blood pressure is bad unless you happen to go out and check for it. So we definitely encourage all of our patients, to regularly check for blood pressure, and again, don't only check when you come to see me. When you're at Publix, when you're at, when Dixie, when you're at Walmart, CVS, all these other places that have free blood pressure machines, go ahead and get them checked. When you have your local health fair, and there's health fairs always going on every other weekend around, where you guys live. Go ahead and get your blood pressure checked as well too, because it's important. Because if you don't get your blood pressure checked, these are some things you have to worry. You're gonna have to worry about. Uncontrolled blood pressure, we know increases your risk for strokes. Uncontrolled blood pressure, we know increases your risk for heart attacks. Uncontrolled blood pressure, we know increases your risk for blindness. We know there's a lot of eye diseases that occur because people don't control their blood pressure for long periods of time. Dialysis, and if any of you know anyone who's on dialysis, if you have long-standing blood pressure and that pressure has been beating up on those kidneys for 5 years, 10 years, we know that can cause problems in the long run and end up on dialysis. In fact, one of the top 2 causes for patients to even be on dialysis is because uncontrolled blood pressure. So this isn't this isn't a drill. This isn't something that is not going to cause any problems if you ignore it. You may be young, especially because I know I have a lot of 20, 30-year-olds who tend to watch my lives. And I know right now, you guys y'all are in that invincible stage where y'all don't think nothing's really bothering y'all at this moment. So it's definitely important to make sure you guys are doing everything you can, especially if y'all got parents who have high blood pressure. Your grandma got high blood pressure. Your uncle got high blood pressure. Your family, your aunt had a stroke. Like all of these things, especially that we're seeing, as young kids, and then we're not like putting 2 and 2 together. Like, oh wow, this person can have a stroke. That means I can have a stroke as well too, right? So we gotta kind of put 2 and 2 together when we're talking about this. We gotta look out for our health from that standpoint there. So before I go, again, we're gonna kind of backtrack and go over. We talked about 5 very common causes for blood pressure. We talked about the genes, the genetics, family history, mom, dad, uncle, grandma, grandpa, all of these relatives that we know have high blood pressure. And if they don't have high blood pressure, they got problems that happen because of high blood pressure. They had a heart attack, they had a stroke, they're on dialysis, they got kidney disease, they got something that is likely due to the fact that they had high blood pressure. We talked about diet being another one. We talked about the salt intake. We're trying to eat as least amount of salt as possible. We talked about your alcohol consumption as well being under the diet umbrella. Again, it takes for patients who are only doing about 1 to 2 drinks, a day. That's enough to kind of slowly raise our blood pressure up from that standpoint. There, we talked about stress. Again, I'll reiterate that stress being a big factor on why a lot of our patients are suffering from high blood pressure at this time as well. We talked about being overweight. So we know, and again, we did that. We did a little 180. We know that you can be skinny and have blood pressure problems, but we know if you're overweight, you have an increased chance of blood pressure problems. So again, for my overweight patients as well, my obese patients as well, definitely something to look out for, especially dealing with blood pressure, especially when you're young, when you can deal with it now. Because when you get older, when you get 50, 60, when you get I won't even go that far. When you get 50 and 40 and 50 and 60, and you're overweight, it's so much harder to to lose that weight. So if you're young and you're spry and you got time, to get to that gym, to eat a little bit less, to change some of your dietary ways, go ahead and change it. Because like, imagine me, right? Imagine me telling, this 60-year-old, hey, I need you to change your whole diet up. A diet that you've been, consuming for 60 years. I need you to change all of that up, or we're gonna have some problems. It's extremely difficult, I can tell you, because I do it over and over and over again on a daily basis here. And I think the last but not least is the smoking. Again, I gave the side eye for everyone who's still smoking cigarettes. Again, we'll leave the judgment to the marijuana from a marijuana. I think that's episode 7 or 8. I'm not sure which one. But I gave the side eye for the folks who are smoking cigarettes. Just stop now. Like there's really no reason why you should be smoking cigarettes. Like, there's absolutely none. Not sure why we even still do it. Not the fact that it's only reason why it's not illegal is because there's a lot of money from the taxing of cigarettes. That's really the only reason why it's not illegal. But we talked about smoking. We talked about how there's not a cancer in this world that smoking doesn't make you at an increased risk factor for. So again, thanks you guys for, listening to the Lunch and Learn. I am about to, today's my half day. I got to run over to the hospital, see a few patients, then, head to the house, relax, really do some work. Most doctors ain't relaxing even when they have a day off. But, you guys have a great and blessed day. I will see y'all next week. And going back in our stress, I know tomorrow's going to be a stressful day for a lot of people. So, we just gotta, do what we gotta do from that standpoint there. Hey, what's going on, Ray? I'm actually about to head off now, but appreciate you for joining. Go ahead and, rewatch this video. I talked about blood pressure and pretty much like 5 common causes for blood pressure. Now, you guys have a great, blessed day, and I'll see y'all later. Bye.